Many expectant mothers feel overwhelmed by the idea of gestational diabetes, but what if I told you that not knowing the key facts could put both you and your baby at risk? In this video, you will learn about gestational diabetes, what it is, and why it matters for expectant mothers and their babies. Pregnancy is a time of immense joy and anticipation, but it also comes with essential health considerations. Among these is gestational diabetes, a type of diabetes that develops during pregnancy. Understanding gestational diabetes is crucial for expectant mothers to ensure both their well-being and the health of their developing babies. This essay will delve into the critical facts about gestational diabetes, providing you with the knowledge you need to have a healthy and informed pregnancy. We will explore the condition itself, who is most susceptible, and the associated symptoms. Additionally, we will discuss potential complications, diagnosis methods, and available treatments. Our aim is to empower you with the information necessary to make informed decisions regarding your pregnancy journey. Let's embark on this informative exploration together. By understanding gestational diabetes, you can actively participate in your prenatal care and minimize potential risks. Remember, knowledge is power, especially when it comes to your health and the well-being of your little one. Gestational diabetes mellitus, or gestational diabetes, is a condition that affects how a woman's body utilizes sugar or glucose during pregnancy. Glucose, derived from the food we eat, serves as the primary energy source for our cells. To facilitate the entry of glucose into cells, our pancreas produces a hormone called insulin. However, during pregnancy, hormonal changes occur that can sometimes interfere with the effectiveness of insulin. When this happens, glucose cannot enter the cells as efficiently, leading to a buildup of sugar in the bloodstream. This condition is what we call gestational diabetes. Typically, gestational diabetes surfaces during the second or third trimester of pregnancy. In most cases, blood sugar levels return to normal after delivery. However, having gestational diabetes increases the likelihood of developing type 2 diabetes later in life. While gestational diabetes can affect any pregnant woman, several factors can increase the risk. These risk factors include age. Women who are 25 years or older have a higher risk. Family history. If you have a close relative like a parent or sibling with type 2 diabetes, your risk increases. Ethnicity. Certain ethnicities such as African Americans, Hispanic Americans, American Indians, and Asian Americans have a higher predisposition to gestational diabetes. Body mass index, or BMI. Being overweight or obese before pregnancy significantly increases the risk. Previous gestational diabetes. If you had gestational diabetes in a prior pregnancy, you are more likely to develop it again. Polycystic ovary syndrome, or PCOS. Women with PCOS, a hormonal disorder, are at increased risk. Previous delivery of a large baby. Giving birth to a baby weighing over 9 pounds can increase the risk in subsequent pregnancies. It's important to note that not everyone with these risk factors will develop gestational diabetes. However, being aware of them can help you and your healthcare provider take appropriate preventive measures. In many cases, gestational diabetes does not present noticeable symptoms. However, some women may experience frequent urination. The body tries to eliminate excess sugar through urine. Excessive thirst. High blood sugar can lead to dehydration and increased thirst. Increased hunger. Inefficient glucose utilization by cells can trigger feelings of hunger. Blurry vision. High blood sugar can affect the lenses in your eyes, causing blurry vision. Fatigue. Your body may feel tired as it struggles to regulate blood sugar levels. Yeast infections. Excess sugar in the body can create a favorable environment for yeast growth. It's crucial to remember that these symptoms can also be common during pregnancy, even without gestational diabetes. Therefore, it's vital to consult your healthcare provider for a proper diagnosis if you experience any of these symptoms. Did any of the symptoms of gestational diabetes surprise you? If you're pregnant, have you been watching out for these signs? Potential complications, mother and baby. When left unmanaged, gestational diabetes can pose potential risks to both the mother and the baby. Complications for the mother include preeclampsia, which is a serious pregnancy complication characterized by high blood pressure and protein in the urine. Women with gestational diabetes are more likely to require a C-section due to the larger size of the baby. Additionally, having gestational diabetes increases the risk of developing type 2 diabetes later in life. Complications for the baby can be quite serious as well. High blood sugar levels in the mother can cause the baby to grow too large, a condition known as macrosomia, which can lead to birth injuries. Gestational diabetes can also increase the risk of the baby being born too early or prematurely. Babies born to mothers with gestational diabetes may experience low blood sugar or hypoglycemia shortly after birth. Premature babies are more likely to experience respiratory distress syndrome, also known as RDS. Lastly, there is an increased risk of obesity and type 2 diabetes later in life for these babies. Timely diagnosis and appropriate management of gestational diabetes can significantly reduce the risk of these complications. Hey, if you're enjoying this content so far, make sure to hit that subscribe button. Join the community so you never miss out on more amazing videos like this. Just click the bell to get notified whenever I upload new content. Diagnosing gestational diabetes involves a simple blood sugar test, typically conducted between 24 and 28 weeks of pregnancy. The test measures the body's response to sugar consumption, the glucose challenge test. This initial screening does not require fasting. You will consume a sugary drink, and your blood sugar levels will be checked 1 hour later. If your blood sugar is higher than the normal range, you will proceed to the next step. The Oral Glucose Tolerance Test, or OGTT. This test requires fasting overnight. Your blood sugar levels will be checked before and after you drink a sugary solution. The test typically lasts for 3 hours, with blood samples taken at hourly intervals. Based on the results, your healthcare provider will determine if you have gestational diabetes. Early diagnosis is crucial for implementing timely interventions and minimizing potential risks. Have you ever been tested for gestational diabetes or known someone who was? What was that experience like for you? Feel free to share your experiences in the comments below. Your insights could really help others going through a similar journey. Treating gestational diabetes involves a multifaceted approach that focuses on regulating blood sugar levels and ensuring a healthy pregnancy. The primary goal is to provide the baby with appropriate nutrients without exposing them to excessively high blood sugar levels. Treatment options typically include healthy diet and regular exercise. Following a balanced diet and engaging in regular physical activity are crucial components of managing gestational diabetes. Blood sugar monitoring. Regularly checking your blood sugar levels helps you and your healthcare provider track your progress and make necessary adjustments to your management plan. Insulin injections. In some cases, insulin therapy may be necessary to control blood sugar levels effectively. Working closely with your healthcare provider, you can develop a personalized management plan that addresses your specific needs and ensures the best possible outcome for both you and your baby. What do you think is the hardest part about managing gestational diabetes? If you've experienced it, what worked best for you in managing it? Diet and exercise play a pivotal role in managing gestational diabetes. Dietary recommendations often include choosing nutrient-rich foods, focus on consuming fruits, vegetables, whole grains, lean proteins, and low-fat dairy products. Controlling carbohydrate intake. Distribute carbohydrate-containing foods evenly throughout the day to avoid blood sugar spikes. Staying hydrated. Drinking plenty of water helps regulate blood sugar levels and prevents dehydration. Limiting sugary drinks and processed foods. These items can cause rapid blood sugar fluctuations. Exercise recommendations usually involve engaging in at least 30 minutes of moderate intensity exercise most days of the week. Choosing activities you enjoy, such as brisk walking, swimming, or prenatal yoga. Consulting with your healthcare provider before starting any new exercise program. By incorporating these lifestyle modifications, you can effectively regulate your blood sugar levels, promote a healthy weight, and reduce the risk of complications. Receiving a gestational diabetes diagnosis can be overwhelming, but it's essential to remember that you can live well with the condition. Seek support. Surround yourself with understanding family and friends who can provide emotional support. Educate yourself. Learn as much as you can about gestational diabetes to make informed decisions about your health. Partner with your healthcare team. Work closely with your healthcare provider to create a personalized management plan. Focus on the positives. Remember that gestational diabetes is temporary and you can have a healthy and fulfilling pregnancy. By actively participating in your care, adopting healthy habits, and maintaining a positive outlook, you can navigate gestational diabetes successfully and welcome your little one into the world with joy and confidence. Living with gestational diabetes can be challenging, but it's possible to thrive. Do you have any personal tips or words of encouragement for others going through it? Thanks for watching. If you like this video, don't forget to subscribe and turn on notifications so you're the first to know when I post new videos. Your support means a lot, and I'd love to have you as part of the community. See you in the next one.